Hello friends, welcome to our channel BDS Vlogs. Today we are going to discuss about differences between maxillary and mandibular central incisors. Very important topic. Coming to maxillary and mandibular central incisors. These central incisors or any other tooth, we will divide them into 5 surfaces. Labial, lingual, mesial, distal. Mesial and distal together called as proximal surfaces, and then incisal surfaces. We'll discuss in detail about maxillary and mandibular in each surfaces of central incisors. Okay. From the labial view, this is the labial view. From the labial view, maxillary central incisors is wider mesiodistally. This is narrower mesiodistally, and this is more symmetrical than this one. Okay, now incisal angles. Incisal angles, the disto-incisal angle is rounded in maxillary incisor, and this is sharper. Both incisal angles are sharper. Okay, and it's a if we draw in midline, it's both are symmetrical, but in the maxillary, symmetry is less. See from here. Symmetry is lessly seen than the mandibular incisors. Mandibular incisors are more symmetrical from labial weave. Labial depressions are frequently seen in the maxillary tooth than the mandibular tooth. Okay, these are the differences from the labial weave. Coming to the lingual weave. From the lingual weave, we will see. From the lingual weave, pronounced marginal ridges are present in the maxillary than the mandibular. See, shallow marginal ridges are present. Fossa is also deep and differentiating. We can differentiate fossa very pronouncedly, it will appear. And here mandibular, there is a shallow fossa. Here somewhat pits are present. No, in this maxillary pits are present, and here pits are absent. See, compared to mandibular cingulum, maxillary cingulum is larger and more prominent also. See here, prominence of mandibular cingulum. Prominence of maxillary cingulum and prominence of mandibular cingulum. So, maxillary cingulum is larger. This is from the lingual weave differences. Then coming to incisal weave differences. See, incisal weave differences, maxillary is more looking like arc shape, and this is more convex on the labial surface. See, this is a labial, this is a lingual, and mesial and distal. Okay, from the labial surface, it is more convex than the maxillary teeth. And central to cingulum, when we draw line labiolingually, it is somewhat distally present. In maxilla, it is centered in mandible. It's important. So, incisal edge is also mid to root axis. If we draw from root axis, it will be midline in the maxillary. It will be somewhat lingual to in the mandibular. And this is a triangular outline. This was somewhat oblong outline is present. Mandibular incisor. Then coming to proximal weave. Mesial weave, maxillary tooth. See, in the mesial weave, maxillary tooth is also wedge shaped and mandibular tooth is also wedge shaped. Labiolingually, this is wider, mandible is wider and this is smaller. It will be very oftenly weaved from the mesiodistal surface. Okay, this is the mesial surface. Root is narrower than the mandibular, and cingulum is elevated. This is a small cingulum, it's not elevated, and root axis is somewhat lingually present. If we draw from midline, 1 minute. If we draw some midline, see, root axis is somewhat labial here, somewhat lingual here. Okay, incisal edge to root axis relationship. Then coming to distal surface, same as the distal developmental groove same as the mesial surface, distal surface is present. Here curvature, cervical curvature is somewhat smaller than the mesial. See, this curvature is smaller than the mesial in both maxillary and mandibular incisors. Then coming to, okay, that's all. Some chronologies about the maxillary and mandibular incisors. So maxillary incisors, first calcification occurs at 3 to 4 months, and this also 3 to 4 months. In evidence of calcification, we will say that 3 to 4 months maxillary and mandibular both will complete. Crown completion will be different. For maxillary, crown completion will take place to 4 to 5 years. Somewhat earlier, this also 4 to 5 years crown completion. And eruption. Eruption, first mandible will erupt, then coming to maxillary. Mandibular central incisors erupts first than the maxillary. So eruption of mandible is 6 to 8 years and maxilla is 7 to 8 years. Root completion, mandible is 10 years and maxilla is 11 years. Then coming to length. Length of the crown and length of the root. 1 minute. So crown length of the mandible is 9 and crown length of the maxilla is 10.5 mm. Root length is 13 mm in maxilla and this is 12.5 mm in mandible. Mesiodistal diameter is 5 mm at the cervical area, that is 3.5 mm in mandible. Mesiodistal diameter is less than the maxillary. And for the mandible, labiolingual diameter is more, greater labiolingual diameter will be present. Okay, labiolingual diameter here will be 5 and labiolingual diameter here will be 5.3 for mandible. Coming to maxilla. Mesiodistal diameter will be 8.5. At the cervix, it will be 7. At incisal area or middle third area, it will be 7. Labiolingual diameter. Labiolingual diameter at the cervical area will be 6. Okay, always at the cervical area, somewhat constriction will be present. So, diameter will automatically decrease than the present at the crown height of the contour. Okay. Now coming to mesial and distal curvatures. Somewhat mesial and distal curvatures will be deeper here. 3.5 for mesial and from distal side it will be 2.5. For mandible, for mesial it will be 3 and for distal it will be 2. So these are important points to note down in maxillary and mandibular central incisors. So comparison will clear your doubts between maxillary and mandible. Mandibular incisors somewhat tilted on distally on the crown. Root is somewhat twisted distally on the crown. So that's all about the maxillary and mandibular central incisors differences. Thank you for watching, guys. Please like, share and subscribe to our channel. Press bell icon for new video notifications. Thank you.